In this video, we'll learn how to document a telephone call to a patient. Patients should be contacted by phone within 7 days to review the results of any abnormal labs that are significantly different from their baseline and warrant follow-up action. For labs that are normal or not really different from their baseline, sending a letter is sufficient. Telephone notes are a three-part process: setting the visit location, writing the note, and entering encounter information. The first step is setting the visit location. Click on the Visit Selector button and type WX PACT Tele MD. If your clinic is at JP, replace WX with BO. Then select the letter that corresponds to your PACT team. If you click the Historical Visit button, this will associate your note with the prior visit, which does not count for workload credit for your preceptor. You should use this option when you are only calling a patient to relay normal labs, not to do any counseling or alter management. For those of you at West Rocks, you'll know you've done this correctly when your preceptor's name appears in the Visit Selector box up here. For those of you at JP, a series of numbers and letters will show up here. I don't know what they mean, but their appearance means you've done it correctly. Step 2 is to type the note. Go to New Note when it loads, and select Primary Care Telephone Note. You must include some version of the phrase "called patient to discuss the results of labs drawn on this date." It's not sufficient to say that you called them to discuss recent labs or labs drawn on their last visit. If I was able to get a hold of the patient, I briefly jot down the important parts of the conversation. If I wasn't able to get a hold of them, I try a total of 3 times at different times of the day and document that in addition to sending them a letter. If they have an unidentified voicemail, or if I'm not sure if their line is private, I leave something like the following. "Hi, it's Dr. Ganatra calling from the VA. Just wanted to go over some recent labs with you. If you could call the call center with a good number and time of day to reach you, I would appreciate it. Thank you." I don't like to leave information on voicemails, but there's a lot of variability in this depending on your preceptor, your relationship with the patient, and the nature of the labs you're discussing. Use your judgment. After you've written the note, the third step is to enter encounter information. Click the Encounter button, and on the Visit Type tab, identify you and your preceptor and the current providers for this encounter. Make sure to designate your preceptor as the primary person. Next, click the Procedures tab and click Physician Telephone Codes. The physician telephone code you select depends on the length and complexity of the call. I almost always do the middle one unless something was really simple or really complex. Next, make sure your name is in the provider box at the bottom, and then click OK. Don't worry about any of those modifiers. Sign your note, and you're done. To recap, documenting telephone calls is a 3-step process: setting the visit location, writing the note, and entering encounter information. With practice, this process will become lickety-split and easy as pie.